Hello everyone, I'm the Mofor of the Clinic of Phytotherapy. I'm here today to present to you causes of infertility in women as regard our last video with the lady who was testifying on her pregnancy and bearing a child after a long struggle. So I'm here today. After that video, many people came up to ask me about what were the causes, what are causes of infertility. So I'm here today to talk to you about causes of infertility in women. One, most women lack a lot of hormonal imbalances that affects them and lead them to infertility. But some women are overweight or underweight. And then some, they have chronic long-term venereal infections that is poorly treated, has not been well treated, that has led to a lot of inflammations, probably pelvis inflammations, cervix inflammations, uterus inflammations, and of course some of them have damaged ovarian cyst that makes them not to reproduce. Some cases it's alcohol. There is alcohol, there is high level of drug, marijuana, Indian hemp, and a lot of hard drinks. So, and then other factors are malnutrition, poor habit of feeding. They don't eat well, they don't drink sufficient water, they don't have enough rest. As well, some are as a result of psychological phenomenon. There are women who have gone through a lot of psychological upset, maybe from men, from the society, from health situations, and many other situations that has greatly affected their psychological aspects. So it makes them feel so bad that for them to get pregnant, it affects their psychological phenomenon that leads to hormonal imbalances. When we talked about the hormone, we are talking about the female hormone, we are talking about the prolactin, we are talking about the gonadotropin, and we are talking about the prolactin, and we are talking about series of other series of other hormonal imbalances, especially on nutrition, because some women, like for example, there was this lady who had miscarriage for over 4 to 5 times at the age of 26 that I came across, and had simply after diagnosing and finding out to know exactly what was her problem, that she had malnutrition. So the baby implantation could not be stable after a couple of months, because women know that when you're pregnant, that is the more you have, that's the time you need to balance stuff, you need to eat well. As specialists your specialists will always educate you that you should eat well, you should drink enough water, take enough food, rest, have enough rest. That is because you're preparing for the baby that is coming, because everything that you eat, the baby will depend on it. So imagine if you don't even have any of these things sufficient enough. Some women will not even get pregnant because of this. So some of them have carried out abortions. That is also one of the factors. Poor abortions that were not properly well done. You know, like for example in Africa, we go by the native way. Most women are afraid and shy sometimes to visit medical practitioners in the hospital to do the right thing correctly. So some of them, they turn around to get things that are not really fine, and they do poor abortions and things like that. At one point they damage their womb, or they damage their cervix and so on, their uterus. So and not only that, there are equally another thing, key thing is that women be very careful. There is also the birth control. Like for example in Africa, where birth control is an issue that is very much alarming, most women, they don't want to get pregnant because they're afraid that they'll go in for abortion. So they go in for it. Either they do birth control, either they do implant, or they do a depot. Those things, I advise you women, if you're still of bearing age that you need to bear children, avoid a depot or implantations to prevent, because when you take them, they upset the hormones not to be stable. In the long run, some women, from research and understanding, when they take a depot or they take some of these things, implants them, when they stop, their body needs to take approximately 1, 2, 3, 4, 5, some even 10 years to reset back to normal. And some even have a lot of side effects, that they have vaginal itches, they have inflammation, some grow up, they become more large and more huge, and a lot of side effects. So that is another cause of infertility in women. And so I call on you women, you take care of yourself, make sure you eat well, make sure you have enough rest, you have a balanced diet. Go to your physicians, let your physician check if your reproductive system is functioning very well, your fallopian tubes, your uterus, if all your hormones are all in place, balanced, and that can really carry you very well, and then you'll be very okay. So